My colleagues and I have several projects related to COVID. One set of studies is analyzing containment policies that have been adopted in the US and how effective these have been in containing community spread. So one of the primary strategies suggested by governments worldwide to reduce the spread of COVID-19 is social distancing, ordering citizens to stay at home. In the US, the most common comprehensive social distancing policy adopted is a shelter-in-place order. It requires residents to remain in their homes for all but essential activities. So in contrast to many countries throughout the world, though, many of the authorities used to combat public health threats in the United States rest not with the federal government, but largely with state and local officials. And so, yes, agencies of the federal government, such as the CDC or the executive branch, can make recommendations and issue guidelines, but the ultimate authority to issue and enforce lockdowns and mandate face coverings and institute policies like that is left to the governor and in some cases to local jurisdictions. And so that's the reason the US has had this mosaic of a landscape when it comes to containment policies, messaging, how quickly states have reacted in response to the pandemic. So in a series of papers, we are empirically investigating how effective these shelter-in-place orders have been. Did they impact social distancing and mobility? Have they flattened the curve of COVID infections? And if they work, when and where do they work best? And are the effects symmetric? So is the effect of actually instituting one of these lockdowns the same as taking a lockdown away? Do they have effects that are similar but in opposite directions? And then in another series of papers, my colleagues and I are studying some very high profile events, such as Black Lives Matter protests for reform in law enforcement and for greater social equality, President Trump's indoor campaign rally in Tulsa, and then recent motorcycle rally in Sturgis, South Dakota, which attracted almost 500,000 people from across the country into this tiny city in South Dakota. And so we're looking at how these have impacted social distancing and mobility behaviors and whether they have contributed to the spread of COVID. And so when you compare why these events have had different effects, this also has really important insights, we feel, for individual behaviors and understanding how COVID spreads and what may help contain it. So I'm an applied microeconomist. I study health and labor markets using real world data and empirical models. I specialize in policy analysis, and a lot of my prior research also pertains to health and income disparities in the US, how individuals behave, how they perceive risk and related issues. So in this sense, the COVID-19 pandemic is sort of a conflation of all of these issues, right? It presents huge challenges for healthcare system, on the demand and supply sides, for the economy, for policymakers. And of course, even after the pandemic subsides, the effects on health and economic disparities are likely going to persist. So in terms of research, this is really an unprecedented opportunity to be able to study all of these issues, gain new understanding, to be able to guide policies to improve population health and narrow these disparities that have persisted for so long. And also, I think most of us would agree that this is likely not going to be our last epidemic or pandemic, right? So the lessons we learn here and the research we conduct now will provide very important takeaway points to be applied for the next time as well. So the other aspect that I very much appreciate is being able to integrate COVID-19 research and studies almost in real time as it's going on in the classroom for my students. I teach a course in the economics of healthcare, and there is not a single module from where we are comparing the healthcare system in the US to other countries, to when we're talking about consumers and insurance, to when we're talking about healthcare providers, physicians, hospitals, the pharmaceutical sector, where COVID does not enter the discussion. And then I also teach courses in econometrics and quantitative modeling at the undergraduate and graduate levels. And so being able to show the data and the models that we actually use in our COVID research in these classes is really exciting for our students to be able to see how these methods that they're learning are being used in practice on the ground as we speak. So in addition to my work on COVID, I'm also working on several other projects. They are broadly in the areas of health, labor markets, and human capital. So in a series of projects, my colleagues and I have NIH funding for a project that's looking at e-cigarette and the vaping markets. So we're looking at advertising, marketing, pricing, policies in this market. Again, this is a very, very important market. It's regulated by the FDA, and given the high rates of vaping among among adolescents and also among adults, right, who are using, vaping as potentially a means of quitting cigarettes. I think these are important issues that the government needs to sort of understand the health costs and the benefits potentially. So in another project, we're also looking at the opioid epidemic, delving more into the so-called deaths of despair and trying to relate how structural economic factors may have contributed to this. And then another ongoing project, we are studying the recent water crisis in Newark, New Jersey. You might have heard about that, where high levels of lead seeped into the tap water. And so we're basically looking at data from New Jersey, and we're looking at how this crisis has impacted pregnant women and the infants that they give birth to. And then my colleagues and I are also studying several important health and labor policies, including the Affordable Care Act, minimum wage laws, and the US safety net, welfare assistance, cash assistance, welfare policies, and food stamps. So one really interesting and important angle that we're adding to all of these studies is sort of an intergenerational angle. So in other words, how are these policies impacting mothers, for instance, right? But also if mothers are being impacted for better or worse, what kind of effects do we see for their children, both when they were kids and when they were growing up into adulthood? So if we can figure out policies that can break the intergenerational cycle of disadvantage, we can really make a dent to disparities at all levels. And I think one of the other sort of angles that we are sort of adding to all of our research projects is that many times we often take a static view of social, labor, health policies and programs. How are they impacting the economy today? Or how are they impacting families and their well-being currently? But it's also very important to consider dynamics. Are the effects persistent, right? Or are they transitory? And how are they improving the well-being of one generation versus future generations as well? And so my co-authors and I are trying to really push on this in several of our projects. And then going forward, of course, the sheer scale of the COVID pandemic, there are likely going to be far-reaching effects, for instance, on students and their learning, right? I mean, there's been huge disruptions there, both for primary, secondary school, and also for post-secondary students. On patients as well, who may have postponed getting their medical care, their preventive care, who may have postponed getting their mammogram or checking their cholesterol because of overrun hospitals or because of fear of going to the doctor or the hospital for something that is not related to COVID. And then the COVID recession also has had so many different effects on different classes of people, income disparities, economic disparities, health disparities. So these are effects that need to be studied as the data becomes available and as they might take time to materialize. And so these are projects my colleagues and I are looking forward to get started and get off the ground.